This video is on handover, the morning handover from 7:30 a.m. and the evening handover from 7:30 p.m. When you are about ready to hand over, you will be using your WOW and you will be moving around from patient to patient as you currently do, and you'll be able to start your handover by going into Care Compass. And when you go into Care Compass, you'll be on the ward that you wish to hand over. As you know, it'll have your patient list. So we're on ward 50. And the first thing you'll do is you have a quick look in your activity timeline. And when double clicking on that, you can see there's anything that's been overdue. And as you can see, there are some things here that are overdue. And if we click into this, it will show us that Mr. BR11 is overdue some of his medication. It would also show you here any other patients whose medication was delayed in being given, as well as any outstanding tasks for the patient that hadn't been carried out will also be here, and any assessment activities. From this, you will then go into our whiteboard. I have set this whiteboard up in the correct columns for handover. I have set the whiteboard up in the order of the columns that has been decided we were going to use for handover. We do have a quick reference guide to support with this, and it's very easy to get the configuration sorted by going into your layout configuration. You will be choosing the columns that you wish by putting a tick into them, and any columns that we don't wish, we take the tick out of, and you just press apply, and then it will form into this view. So if we can imagine now that it is 7:30 a.m. or p.m. and we're about to start handing over our patients, in most areas what happens is you have your safety huddle followed by your handover, and in adult areas this can be anything up to 14 patients. We will start with the first patient here, and by this clicking into the first box next to this patient, you get a pop-out box. This will tell you the patient's name, the patient's age, it will tell you if they've got any allergies, and it will also tell you how long they've been in hospital. It will give you the illness severity, which is saying stable at this precise moment in time, and any other information that's been recorded against this patient. Actions will be actions that will have been recorded from the board round for that day. You have then got other lines across here that you can click into by going into your clinical data. You will be given the last set of vital signs here, and you can have further views if you wish to. It also gives you any current labs, but what it would also give you is the medications this patient is on. So you're able then to have a look at the medications and discuss anything that needed to be discussed for this patient. It also gives you the fluid balance chart, so you're able to see if this is up to date and discuss as needed. And if need be, you have also got information on the care team that is looking after the patient and has been looking after the patient today. To come out of your boxes, you just click your little cross. You don't need to go into boxes if the information is displayed. So as you can see here, it's telling me what bed this patient is in and what bay they are in. DX stands for diagnosis. As you can see, they've come in with an acute exacerbation of their COPD. We also have problems. Our problems page gives you information on any past medical history and other problems that this patient has. And they will be recorded there, so if they were hypertensive or anything else as part of their past medical history, you'll be able to see it into problems. It then lets you know straight away if they're allergic. So this patient's allergic to augmentin. If you wanted to know more information about it, you can click into the box and it will tell you that it's mild and they get diarrhea. But for the purpose of a handover, you might just want to say allergies, allergic to augmentin. The patients will have their rhesus status filled in. I haven't got all of this filled in because that's something that is completed by the doctors, but you will see a heart here that gives you the status, and as you see, this patient is a full rhesus. Their latest ooze score will pull through to here, and if the patient has been isolated for any form of infection, that will also be on this board, and if you click into the box, it will give you some more information about it. If your patient is at risk of falls, it will say here, and from the falls assessment that you complete on admissions, and every 7 days, if there's any safeguarding issues, you can see it here. And again, clicking into the boxes, if you want any more information, you can go to the open record and it will take you to the page and you're able to see a little bit more information. If they're on any kind of special diet, this box is about diet. We'll be clicking in here and it'll give us some information. So if there is no special diet, they'll be on a normal diet. If they're being seen by the physio, you'll be able to click into this box and it gives you a little bit more information about what's happening with the physio. When we were discussing what we wish to have on our whiteboard for handover, the group of senior nurses who have pulled this together have gone for temporary comments. Now, temporary comments is where you're able to put a comment in for the patient, but it doesn't pull through once the patient has been discharged. This is just comments that's on this board for the nurses who are looking after this patient. And what was decided by the senior nursing group that pulled this together with me was that they would like the idea of having in the temporary comments if your patient was being specialed, what level they were a level 3 or level 4, and they also felt that this was a great place for us to document if our patient was end of life, so we're able to see this straight away when we are handing over. Our illness severity is where we're able to say what's happening with our patient, whether they're stable, unstable, going home tomorrow for discharging, or being watched. So the majority of the patients, as you can see on here, are stable at the moment. We've identified the patients who are going home tomorrow so that we're able to start making sure that everything's in place and these patients are ready to go first thing in the morning. And we've also put watch next to the patients where we know they're a level 4 or level 3 and they've got a one-to-one in place. Unstable is for patients that we have some concerns about, so the nurses are aware that we wish to keep a very close eye on those patients. Actions, again, is for the actions that have been set out that morning on board round, and you can see what they've been, whether they've been completed or are still outstanding to be done. We've kept tasks in there for now because this will show any outstanding tasks that haven't yet been done for this patient, and it'll give you the opportunity to hand this over. So if you had a patient who's just arrived onto your ward at 6 p.m, 6 a.m, and you have only been able to do the safety assessments and some vital signs but not complete their admission, then you're able to hand over those tasks to the nurse that's coming on duty. And it also pulls through the nurse handover note that you would have completed earlier on in your shift, and you're able to go into that record. If you just click onto here, it will open up the record for what you've written, what you wrote about the patient when you were completing your handover notes. So these are the generic fields that we wish to have in our handover. Of course, if any other area wishes to add anything further, then they can add those through the layout configuration. But the generic list for handing over is this order. And like I said, there is a quick reference, guys, to how you set this board up in this correct order to be able to hand over at the end of your shift.